Yeah, Dr. Fauci, among those I didn't see in the Rose Garden. Our notes don't indicate that our teams that are there see him right now. But he has said, if the science proves that this thing is effective and safe, he too will take it. And that really is going to be a challenge for so many Americans who have heard misinformation about the way this vaccine process works, whether they feel comfortable with it. Ultimately, it'll be the doctors and the scientists who should make all Americans feel comfortable with it. Dr. Patel, to you right now, we heard the president's criticisms of Pfizer. He said that they've already got the money for the doses that they would be producing. I don't think it works that way. When they do produce the doses, they'll receive those $2 billion. But what struck you as you hear the president's comments about the state of where we are with this vaccine and the likelihood that Americans, regular Americans, I guess, not your frontline workers and other more vulnerable Americans, will likely see it beginning in April?
Yeah, Peter, a couple of things. Number one, he did make some comment that made it sound like as the vaccine is available, we'll start to see this virus just kind of slowly go away. Just a fact that this is at least a 2-dose vaccine separated by 3 weeks, and it does take weeks to develop immunity. So it's even the healthcare workers like myself that might get it first. It's not going to be something where all of a sudden the virus just kind of goes away or that I don't have to worry about masks, et cetera. Second, this is a complex supply chain distribution issue. Pfizer is preparing kits with dry ice because it requires 70 degrees below 0 Celsius for storage and only lasts about an hour outside of those conditions. So this is not something, Peter, that you and I can just walk into a regular pharmacy unless it's already outfitted with that type of storage requirement, which means we get back to that important comment about transitions and supply chain issues. And so I'm just putting in a more conservative estimate that more Americans will receive this likely in the summer, possibly later, to be a bit more realistic.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.